Get started as a subcommittee. Once we get enough members here, we will interrupt, establish a quorum, and then move forward. A couple of announcements. We have 2 items on consent. Item number 2, AB 72, Bonta. Item number 7, AB 366, Bonta again. And I believe that Assemblymember Bonta will be presenting item number 5, AB 339, for Assemblymember Gordon. So when Bonta is up, I believe when he's up in item number 4, because we do file order, we will have him do the Gordon bill as well. So with that, members, we're going to go ahead and get started. I believe we're at item number 1, AB 68, Waldron. I saw her here in the audience. Please come on up. We do not have a quorum as of yet, but we will get started. Good morning. Good afternoon, Assembly Member.
Thank you, Mr. Chairman and members. First of all, I would like to thank the chair and the committee for working with me. The chair and I have talked and come up with the amendments in front of you, and I really appreciate the time. These amendments change the appeal in the original bill from an automatic urgent appeal to an urgent appeal, and to require the Medi-Cal beneficiary or the Medi-Cal beneficiary's provider, with the consent of the beneficiary, to request the appeal either orally or in writing. The bill also reduces the time frame to 24 hours for the plan to resolve the appeal. Assembly Bill 68 creates the expedited 24-hour appeal process for Medi-Cal patients, allowing them to promptly access the drugs they need to control their condition, epilepsy. Right now, patients have to go through multiple appeals processes and experience significant delays in order to receive the most suitable drugs to treat their condition. Epilepsy is a life-threatening illness. Medical experts say that the first treatment is typically the best chance to get the disease under control. Current step therapy programs and drug formularies can be a barrier to access for epilepsy patients. AB 68 passed the Assembly floor unanimously and is supported by AFSCME, the Association of Regional Center Agencies, Biocom, California Chronic Care Coalition, California Healthcare Institute, California Life Sciences Association, Child Neurology Foundation, Disability Rights California, Epilepsy California, and Synovian Pharmaceutical. Here I have with me Rebecca Halliwell, representing Epilepsy California, and Dr. Michael Rogowski, Professor of Neurology at the University of California, Davis. In support and to address any questions you may have, I respectfully ask for your aye vote.
Thank you. Before we get started, let me just make another quick announcement. Normally in this committee, we allow a total of 6 minutes for the proponents, 6 minutes for the opponents. You can divvy up the time any way you wish. After that, if there's anybody that's going to speak either in support or in opposition, that I ask that you only state your name and your position. With that, please proceed.
Good afternoon. My name is Rebecca Halliwell. I'm the I'm the Executive Assistant Director, pardon me, of the Epilepsy Foundation of Greater Los Angeles, and I'm here to testify on behalf of Epilepsy California. Epilepsy California is a statewide grassroots organization made up primarily of individuals and family members affected by epilepsy, and also medical professionals and service providers. We thank Assemblymember Waldron for drafting a bill that aligns with our priority to ensure access to all anti-seizure medications for the nearly 400,000 Californians with epilepsy. I've shared a packet of information that you should all have received, and that just shares more information about epilepsy, and you can also use that as a resource for you and your constituents. We strongly support the intent of AB 68, as we know how imperative it is that people with epilepsy have consistent and ready access to the medications that most effectively treat their medical needs. As Dr. Rogowski will elaborate on, the epilepsies are unique diseases of the brain, and the treatment of each individual with epilepsy is also unique. There are many types of epilepsy, many types of seizures, and many treatments. When it comes to treatments, there is no one-size-fits-all. I'm confident that you all want to ensure that a person with epilepsy on Medi-Cal receives the medication that best controls their seizures. because as our community knows all too well, a breakthrough seizure can jeopardize an individual's quality of life or even result in death. AB 68 will help to ensure that there is no additional risk to the community that already has an increased mortality rate of up to 3 times that of the general population. AB 68 will help to prevent any interruption of treatment, thereby preventing any individuals from cutting their pills in half while they're waiting for the authorization to be approved or needing to take any inadequate alternative just because that's what happens to be on the formulary. AB 68 will help to prevent another mother from visiting the ICU because Medi-Cal denied her son the medication that had controlled his seizures. AB 68 will help to ensure a child with epilepsy Medi-Cal will not have what another child has had, where he's had difficulties accessing the different medications. He went through 13 different medications. They all failed. And he's had to wait up to 45 days for the approval of a new medication. We're confident that the passing of this bill will improve the quality of life and reduce the risk of death for those with epilepsy in California. So please vote yes. Thank you.
Anyone else? Please proceed. State your name.
My name is Michael Rogowski, and I'm professor of neurology at UC Davis, and I'm a clinician at UC Davis Medical Center. Prior to coming to UC Davis, I was head of the epilepsy research section at the National Institutes of Health in Bethesda, Maryland. I've been here in Sacramento for about nine years. My area of expertise is in epilepsy therapy. I've been involved in development of anti-epileptic drugs and in doing research on the mechanism of action, and also working with companies to develop new treatments for epilepsy, where our research is funded primarily by the National Institutes of Health. And I also see patients with epilepsy at the UC Davis Medical Center. I want to thank the Epilepsy Foundation for the invitation to be here and to be able to speak on this issue, which I think is so important. I just want to kind of emphasize a few aspects about epilepsy as a disease, which distinguishes it from other conditions that clinicians are faced with. Epilepsy is a very serious condition. When our patients are controlled with medications, we're very pleased, they're pleased, their families are pleased. But that only happens in about 50% of the cases. In the remainder, we struggle to find the appropriate medications to treat our patients, and oftentimes they continue to have seizures despite our best efforts at providing therapy for them. A seizure is very problematic for a patient in terms of the impact on their quality of life. If they have a seizure at school or in the workplace, it can be associated with significant stigma. They can oftentimes lose their job because employers don't want to have somebody in the workplace who's at risk of having a seizure. More importantly, they can injure themselves when they fall. They might hit their head. And an uncontrolled seizure can actually lead to death. Unfortunately, this is something that we didn't recognize as well when I was in medical school and in training, but in recent years we've become aware of the fact that people with uncontrolled seizures are at a significantly higher risk of dying as a result of their seizures. So it's extremely important that they get appropriate treatment and that seizures are controlled adequately. Now, one of the things that distinguishes our area from that of other areas of medicine is that we have many, many different treatments for epilepsy. It turns out there are about 25 different chemical entities that are marketed for the treatment of epilepsy worldwide. And we use probably 10 or 15 of those in routine practice. Each one of those is different in terms of its molecular action on the nervous system, on the way it prevents seizures from occurring in the brain. And so these are not interchangeable medications. And when a physician determines that a certain agent is appropriate for a patient, it's problematic if that individual encounters difficulty.
If you don't mind, we'll have you wrap up. The time has already been pass. So we'll just have
Okay,
you
well,
summarize.
thank you for that. I was just leading to the point that any impediments that can occur in patients gaining access to medications is problematic. And the intent of this bill is to reduce the barriers that patients have in gaining access to the appropriate medications. And that's the reason why we are so strongly in favor of this legislation.
Thank you. Before we move on, we're going to go ahead and establish a quorum. We can call the members, please.
Hernandez?
Here.
Hernandez here. Nguyen? Hall? Mitchell? Monning? Monning here. Nielsen? Nielsen here. Pan? Pan here. Roth? Wolk? Wolk here.
Okay, a quorum has been established. At this point, we're just going to ask that you just state your name and your position, please.
Jerry Jeffy, representing the California Chronic Care Coalition, in strong support.
Brandon Tartaglia with Disability Rights California in support.
Shannon Smith Crowley, representing Sanofian Pharmaceuticals, in support.
Anyone else in support? State your name.
Daniel Savino, Association of Regional Center Agencies, also in support.
Moira Top here on behalf of Biocom in support.
Thank you.
Laura Fitzgerald on behalf of the California Life Sciences Association, formerly known as CHI and Bay Bio, in support.
Thank you.
Eduardo Martinez with the California Medical Association in support.
Thank you. Opposition?
Mr. Chair and members, Nick Luizos on behalf of the California Association of Health Plans. We have an opposed unless amended position on this bill. We do believe in the unamended version that it will increase costs for Medi-Cal managed care plans. As I stated last week on a bill, the rates that are paid to plans today are based on data that was submitted to the department 2 years ago. So any expansion in benefits or costs may not be accounted for in the rates that are paid by the state to the plan. So that is a fundamental concern of ours. Our main problem with the bill as it came out of the Assembly is that it, in our view, doesn't allow the plan to ask for additional necessary information and documentation from the provider about the need for this expedited process. We are reviewing the amendments that are taken in committee today. We just got the final mock-up this morning. So if that changes our position, we will let the Assembly member know and the committee know. But at this time, I'm unable to remove my opposition to the bill.
Thank you very much. Anyone else in opposition? Questions from any of the members? Seeing no questions from... Okay, we have a motion by Senator Wolk. Just a couple comments. In the initial form of the bill, I was opposed, and I had the pleasure of speaking to the Assembly member yesterday, and she was very, very passionate about the issue. And the concern I had was the automatic appeal, but also similar to what the concerns were by the health plans, that the ability for the plans to be able to control cost, but I was trying to kind of outweigh the needs of the patient. And so I think what we did is we struck a balance, which wasn't an automatic appeal, but it was an appeal on behalf of the patient. We reduced the amount of time from 48 to 24 hours for a response. And the reason why is because of the importance of the types of medications that are there, but you still have the checks and balances, and I really believe it should go to the plan as opposed to the department, and to allow the plans to still have some kind of control, cost control measures and the ability to bulk purchase or purchase medications as well. So I think there's that fine balance that allow this segment of the population to access to a medication that's very necessary. And with that, would you like to close?
Thank you, Mr. Chairman. Once again, I thank you for your work on this. I really appreciate it. I think it's a benefit to the patients who are suffering from epilepsy, many of them who can't get their seizures under control, and parents who are just distraught over it. And it does strike that balance with the healthcare plans that they actually get another bite at the apple, that they can look at it again and make sure that their initial denial was either sound or not. And it gives the information back to the patient quickly. So I appreciate it. And I urge your aye vote. Thank you.
Thank you. This is due pass as amended to appropriation. The chair is recommending an aye vote. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Mitchell. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Wolk. Wolk, aye.
Currently has 5. It's enough to get out. We have members absent. We're going to place that bill on call. Thank you very much.
Thank you.
I think Assemblymember Santiago was first. We're actually file order, so technically it's supposed to be Bonta, but I don't see him here yet, so we'll bring up. Wait. It's Gaines? Wait. All right, so we'll bring up Assemblymember Gaines.
Thank you, Mr. Chair.
Sure, good afternoon.
Thank you so much. I'll make this quick. Okay, AB 572 would require the Department of Public Health to create and submit to the state of California a diabetes action plan. The goal of the plan is to address the escalating $37 billion a year impact diabetes has to the state of California. AB 572 will use evidence-based strategies aimed at prevention and awareness of costly diabetes-related complications. The plan will also detail the financial impact on the state, as well as provide policy guidance to the legislature aimed at preventing diabetes in California. AB 572 has received unanimous bipartisan support, and I respectfully request your aye vote.
Thank you very much. Anyone like to speak in support of the measure?
Amber King with the Association of California Healthcare Districts. We believe this is a really important measure for the prevention of diabetes and urge your strong support. Thank you.
Thank you.
Jerry Jaffe, representing the California Chronic Care Coalition, in support of the bill.
Laura Fitzgerald on behalf of the California Life Sciences Association, formerly known as CHI and Bay Bio, in support.
Thank you.
Hi, Mike Montgomery, Congress of California Seniors. We support the bill.
Thank you.
John Winker on behalf of Biocom in support.
Thank you. Anyone else? Opposition? Questions, comments from any of the members? Yes.
Thank you, Mr. Chair. I just want to thank the author for your continued focus on diabetes prevention. I know it's an issue near and dear to your heart, and also to Senator Gaines, and just appreciate your continued focus. There was an interesting op-ed in the Sacramento Bee yesterday by Dan Weintraub talking about our Affordable Care Act and expanded insurance coverage, but continued trajectories of youth obesity leading to preventable type 2 diabetes, and not necessarily any impact on those trends, even based on expanded healthcare eligibility. So I look forward to working with you in your continued efforts to educate and activate our communities. So thank you very much.
Thank you.
Thank you. Anyone else like to make a comment? Seeing none, is there a motion? Moved by Senator Pan. Would you like to close?
Thank you. I really appreciate your support on this growing epidemic. Thank you.
Thank you. Chair's recommending aye. This is AB 572, due pass to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall.
Aye.
Hall, aye. Mitchell. Monning.
Aye.
Monning, aye. Nielsen. Aye. Nielsen, aye. Pan. Aye. Pan, aye. Roth.
Thank you.
Wolk. Wolk, aye.
Currently has 6, enough to get it out, but we're going to place that bill on call.
Thank you, Mr.
Thank
Chair and
you.
members. Appreciate
Now, Assemblymember Santiago. Item number 14, AB 1102, Healthcare Coverage Medi-Cal Access Program Disclosure. Good afternoon, Assemblymember.
Good afternoon to you, Mr. Chair and Senators. First, I want to begin by thanking the Chair for helping us to create a better bill and really spending the time over the last couple of weeks to ensuring that we got the outcome that we wanted, and thank you to the committee staff as well. So really do appreciate it. AB 1102 helps to provide increased information about healthcare coverage option for women who become pregnant. As you know, the lack of healthcare care is a significant barrier to ensuring that we have healthy babies once they are born. And while there's different options for healthcare coverage, such as Medi-Cal or Medi-Cal Access Program, there are those people who, or those women who do not qualify, and so we want to go ahead and refer them to the major risk medical insurance program that was created to ensure that there was a health safety net for those women who were, or those folks who were not covered under other programs. So specifically, AB 1102 would require the Department of Healthcare Services to inform pregnant women who are denied coverage either by Medi-Cal or Medi-Cal Access Program about the Mr. MIP program. And this bill would ensure that all women are afforded the opportunity for important preventive measures that comes along with prenatal care, so that we ensure that the woman is healthy and so is the babies who are then born. Thank you, Mr. Chair. We have one witness who will be brief, or two witnesses who will be very brief.
Thank you very much. Please proceed.
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty. We would like to thank the Assembly member for his commitment to making sure that pregnant women get the health coverage that they need and the important prenatal care that they need. We were in support of the last version of the bill, but also support this version. Mr. MIP is precisely there to make sure that folks who can't get coverage otherwise can get coverage, and so we're here in support. Thank you.
Thank you.
Beth Capel on behalf of Health Access California. The Major Risk Medical Insurance Program has existed for more than 20 years to make sure that people who are otherwise uninsurable in the individual market can get coverage when they need it. That's why we preserved it even after the creation of the Affordable Care Act. Some folks will miss the open enrollment periods and will need coverage in between, and so we are delighted to be in support of this version of the bill. Thank you.
Justin Garrett with the March of Dimes in support.
Michelle Cabrera with SEIU in support.
Anyone else? Support or opposition?
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. I would like to thank the author, the sponsors, and the chair of the committee for working so diligently on this. We're happy to be here today to remove our opposition to the current bill. Thank you.
Thank you. Jennifer Cabales with the California Association of Health Plans. Also very grateful for the hard work on this bill, and we are too removing our opposition.
John Winger on behalf of America's Health Insurance Plans, also removing opposition.
Thank you very much. Anyone else? Questions, comments from any of the members? See no questions or comments? Senator Pan, he was first. I heard Pan first. Assembly member, I definitely want to thank you for taking the time to work with me on this issue. I'm definitely going to be supporting the bill, and with that, would you like to close?
I respectfully ask for your aye vote, and thank you to the members of this committee.
Thank you. So this is AB 1102, due pass to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall.
Aye.
Hall, aye. Mitchell. Monning. Aye. Monning, aye. Nielsen. Pan. Aye. Pan, aye. Roth. Wolk. Aye. Wolk, aye.
Currently has 5, enough to get out, but we're going to place that bill on call.